Many people dismiss skin changes as purely cosmetic concerns, but these visible signs often appear months or even years before other symptoms develop. Jaundice, yellow skin and eyes. When your skin and eyes turn yellow, it means a substance called bilirubin is building up in your blood. This happens when your liver isn't working properly to clean out old red blood cells. The yellow color usually shows up in your eyes first, then spreads to your skin. This can signal liver disease, hepatitis, or blocked bile ducts, so you should see a doctor right away. Paleness. If you suddenly look much paler than usual, especially in your nail beds and inside your eyelids, you might not have enough healthy red blood cells. This condition, called anemia, can happen from not eating enough iron, losing blood, or having diseases that affect blood cell production. You might also feel tired, weak, or short of breath, along with the paleness. Acanthosis nigricans, dark velvety patches, dark, thick patches that feel like velvet, often appear in skin folds like your neck, your armpits, or your groin. These patches usually mean your body isn't using insulin properly, which can lead to prediabetes or type 2 diabetes. While it might look like dirt, it's actually a skin condition that signals hormone problems, or rarely internal cancer. Persistent flushing. If your face stays red or gets red very easily, it could be rosacea, hormonal changes from menopause, certain medications, or alcohol sensitivity. Sometimes frequent flushing can signal blood pressure issues or rare hormone-producing tumors. If your face stays red for weeks or gets worse, it's worth seeing a doctor. Changing moles, moles that change in size, shape, color, or texture, might be turning into skin cancer called melanoma. Doctors use the ABCDE rule to check moles. A stands for asymmetry, B for irregular borders, C for mixed colors, D for diameter bigger than a pencil eraser, and E for evolution over time. If a mole starts bleeding, itching, or looks different, show it to a doctor because catching skin cancer early makes it easier to treat. Poor wound healing. When cuts take a very long time to heal or keep getting infected, it might signal diabetes, poor blood flow, or vitamin deficiencies. High blood sugar from diabetes makes it harder for your body to fight germs and build new skin. If your wounds aren't healing normally, it's important to find out why so you can get proper treatment. Excessive skin tags. Skin tags are small, soft pieces of skin that hang off your body like tiny balloons. If you suddenly get many new skin tags in different places, it might mean your body isn't handling sugar properly, or you have hormone changes. While skin tags aren't dangerous, having lots of new ones might signal insulin resistance or diabetes. Changes in skin moisture, sweating, or dryness. Your thyroid gland controls how fast your body works, and this affects your skin's moisture. If your thyroid makes too much hormone, you might sweat a lot and have warm, moist skin even when it's not hot. If your thyroid doesn't make enough hormone, your skin might become very dry and cool no matter how much lotion you use. Recurring skin infections. If you keep getting skin infections that come back even after treatment, your body might have trouble fighting germs. This often happens with diabetes because high blood sugar feeds harmful bacteria and fungi. A weak immune system or poor blood flow can also make infections more likely to return. Unexplained bruising. If you bruise very easily or get bruises without remembering how, something might be wrong with your blood's ability to clot. Your blood has special cells called platelets that help stop bleeding when you get hurt. This easy bruising can happen from certain medicines, liver disease, blood disorders, or not getting enough vitamin C. Stretch marks, striae. Normal stretch marks happen during growth spurts or pregnancy and fade from red to white over time. But if you suddenly get wide, dark purple stretch marks without gaining weight, your body might be making too much cortisol hormone. This condition, called Cushing's syndrome, can cause serious health problems and creates abnormal stretch marks on your stomach, back, and limbs. Red, scaly patches. Red, rough patches that don't go away with lotion might be psoriasis, eczema, or even skin cancer. Psoriasis happens when your immune system makes skin cells grow too fast, creating thick, scaly patches. Some red patches could be skin cancer, especially if they bleed, crust over, or don't heal after several weeks. Hair loss patterns. Losing hair in round patches might be alopecia areata, where your immune system attacks hair follicles by mistake. Thinning hair all over can signal thyroid problems or lack of iron, protein, or other nutrients. Sudden, severe hair loss can happen after major stress, illness, or hormone changes like pregnancy or menopause. Scaly peeling skin. When your skin constantly peels or flakes, especially around your mouth, hands, or feet, you might not be getting enough vitamins or water. Vitamin deficiencies can make your skin unable to repair itself properly. If regular moisturizer doesn't help after a few weeks, it could be a fungal infection or other skin condition that needs medical treatment. Purple spots that don't fade. Small purple or red spots that don't turn white when you press them mean tiny blood vessels under your skin are bleeding. This happens when you don't have enough platelets or when medicines make it harder for your blood to clot. These spots are different from regular bruises and should be shown to a doctor, especially if you have many of them. Cold, clammy skin. If your skin feels cold and sweaty at the same time, it might signal low blood sugar, shock, heart problems, or severe anxiety. This can be a sign of a medical emergency like a heart attack, especially if you also feel sick, dizzy, or have chest pain. Your body uses skin temperature and moisture changes to warn when something serious is happening. Vitiligo, white patches. Vitiligo creates white patches where color-making cells have been destroyed by your immune system, attacking them by mistake. These patches often start on hands, feet, or face and can appear anywhere on your body. People with vitiligo often have other autoimmune conditions like thyroid disease or diabetes, where the immune system attacks other body parts too. Excessive hair growth, hirsutism. When women grow thick, dark hair in places where men usually have hair, face, chest, back, their hormones are often out of balance. The most common cause is polycystic ovary syndrome, PCOS, which affects the ovaries and can cause irregular periods and weight gain. Other hormone problems with the adrenal glands or certain medications can also cause this unusual hair growth pattern. Skin ulcers that won't heal. Ulcers are deep sores that go through several layers of skin and don't heal within a few weeks. Diabetes is a common cause because high blood sugar damages blood vessels and nerves, making healing difficult. Poor blood flow, autoimmune diseases, or certain skin cancers can also prevent proper healing, so any non-healing wound needs medical attention. Xanthomas, yellow fatty deposits. Xanthomas are yellowish, waxy bumps that appear when you have too much cholesterol or other fats in your blood. They often show up around your eyes, elbows, knees, or on tendons in your hands and feet. Having these deposits means you're at higher risk for heart disease because the same fats building up in your skin are probably also clogging your arteries.